My name is Bill Walsh, PhD. I'm from the USA, and I'm the founder of the Walsh Research Institute in Naperville, Illinois. We're a dedicated group. We're a not-for-profit public charity, and we engage in research with respect to the brain and how natural substances can improve people with brain problems. We are involved heavily with physician training programs, such as the wonderful program that goes on in Australia with the Biobalance Association. We've the goal of training more than 1,000 doctors in the next few years, and we're well underway. I think we're already 30 to 40% along the way there. And basically what we do is a medical procedure that involves adjusting brain chemistry and neurotransmitter function using nutrients. Nutrients have great power, and we recently published a book called Nutrient Power that gives chapter and verse of how this can benefit people. And it's not necessarily an alternative to psychiatric medications, but very often psychiatric medications are not needed if you can identify chemical imbalances or nutrient imbalances in the brain that can often be the cause of these problems.
Bill, in what ways is this training program unique from anything else in the world for integrative practitioners?
What's different about the Biobalance Walsh Research Institute training program for doctors is that we don't just do lectures and we don't just force feed information. We have a key part of the program is to have patient evaluations. We have live patients come in. For example, the program we're having at the moment here in Australia, every doctor who's in training over this period has the opportunity to sit in and participate in about 50 patient evaluations. And this includes in-depth medical history, and then evaluation of lab results, diagnosis, and then treatment design, and we do this over and over and over. And in my room, when I'm doing this with the doctors, the first day or two I may dominate things, but as time goes on I have them doing virtually everything, including evaluation of the lab work and designing treatment programs. So it really enables them to learn how to incorporate this quickly into their clinical practices.
What are the lab tests that you do for the outreach, and what are the importance of these lab results?
Well, we've learned that with respect to brain function, with respect to neurotransmitter function, there are only about 7 or 8 nutrient factors that dominate mental functioning, and at least 90% of the patients we see with depression or anxiety, or children with behavior disorders, or perhaps bipolar or schizophrenia, 95% of them have as their major problem nutrient imbalances that impact neurotransmitters, and that's great because there are more than 300 important nutrients in the body, but only a handful that are really important or dominate brain function. So we have a portfolio of lab tests that include plasma zinc, serum copper, serum ceruloplasmin, whole blood histamine, or blood testing for SAMe and SAH. We do urine pyrroles. There's a limited number of tests that only cost about between $300 and $400 US dollars to do the testing, and that's usually enough, together with a really good medical history, to accurately diagnose and treat a person.
Fantastic. Bill, what makes you want to keep returning to Australia each year to train Australian doctors?
Actually, I like coming to Australia because we have a terrific organization, a not-for-profit organization called Biobalance, that prepares the way for us, and it's really quite remarkable, and it's unique in the world. We've been to Norway, we've been to England, we've been to Ireland, we've done programs in the USA. Australia is different. It's so well organized, and so we don't have to do a lot of the preliminary effort. And also we find that doctors here are so eager to learn these things. Every year I've come, and it's now I think 12 times. We started with one doctor the first time many years ago, and every time we provide these training programs, more and more doctors come, and most recent case, we had 74 doctors, I believe, with a few more that would have liked to have come. And so I like coming here because the many doctors, especially the complementary medicine doctors in Australia, are really eager to learn advanced therapies and get really up to date on research that can guide their treatment and help their patients.